Gene therapy is a way of fixing or preventing different diseases by putting new genes into our existing cells. It is a method to fix defective genes responsible for disease development. Instead of using drugs or surgery, doctors might use this method in the future to treat illnesses by adding specific genes into a patient's cells. In 1960, a year when the concept of gene therapy was introduced. Then, in the 1970s, scientists Friedman and Roblan wrote a paper in Science called Gene Therapy for Human Genetic Disease. In this paper, they mentioned the first ever attempt to do gene therapy.
William French Anderson was born on December 31, 1936. He is an American physician, geneticist, and molecular biologist. He is known as the father of gene therapy. In 1990, he was the first person to succeed in carrying out gene therapy by treating a 4-year-old girl suffering from severe combined immunodeficiency. It is a disorder called bubble boy disease. It was a treatment for a genetic effect that left her with an immune system deficiency. So the 4-year-old girl named Ashanti De Silva. The first approved gene therapy case at the National Institute of Health, UK. So the new gene therapy approach repairs errors in messenger RNA derived from defective genes. This technique has the potential to treat the blood disorder, thalassemia, cystic fibrosis, and some cancers. Sickle cell disease is successfully treated in mice.
In the year 1992, Dr. Claudio Bordignon, working at the Vital Salute San Raffaele University, Milan, Italy, performed the first procedure of gene therapy using hematopoietic stem cells as vectors to deliver genes that is intended to correct the hereditary diseases. In the year 1999, the death of Jesse Helsinger in a gene therapy experiment resulted in a significant setback to gene therapy research in the United States. And also, in the year 2006, scientists at the National Institutes of the Health Bethesda, Maryland, they have successfully treated metastatic melanoma in 2 patients. This study constitutes one of the first demonstration that gene therapy can be effective in treating the cancer. In the year 2007 and 2011, research is still ongoing and the number of diseases that has been treated successfully of the gene therapy is increases. And there are 3 diseases that can be treated by the gene therapy. The first one is the retinal disease, second is the color blindness, the third is adrenoleukodystrophy. And lastly, in the year 2011, medical community accepted that it can cure HIV as in 2008 by Dr. Hiro Hatter, and he has cured a man who has a HIV.
Types of somatic gene therapy. The first one is in vivo somatic gene therapy. This involves directly administering therapeutic genes into the patient's body. Common delivery methods include viral vectors or direct injection. Targets specific tissues and organs to address genetic disorders locally. The next one is ex vivo somatic gene therapy. This involves modifying the patient's cells outside the body before reintroducing them. Cells are typically extracted, genetically modified in a controlled environment, and then returned to the patient. This is commonly used in disorders affecting blood cells, such as certain types of cancers or blood disorders.
Gene therapy is a medical approach that uses genetic material to treat or prevent disease. The basic process involves the identification of the gene to be altered or replaced, duplication of that gene, and the insertion of the gene into the human genome needing the gene. The genetic material, such as a working gene, is delivered into the cell using a vector. vector, which is like a package used to deliver a specific message. This vector can be a viral vector or a non-viral vector. There are two main ways to deliver gene therapy. First, in vivo, where the genetic material is delivered directly into the person, and while the ex vivo, where the person's own cells are removed and the genetic materials is delivered to these cells outside the body. The key steps in the gene therapy treatment process include consultation, preparation, treatment, and follow-up. So the treatment process relies on close collaboration between the primary treatment team, the patients, and their caregivers. The process of gene therapy is a complex and evolving field with the potential to address the underlying cause of disease or instruct the body to produce essential proteins. Several approaches to gene therapy are being tested, including replacing a mutated gene that causes disease with a healthy copy of the gene, inactivating a mutated gene that is functioning improperly, and introducing a new gene into the body to help fight the disease. So, what is vector? A vector in the context of gene therapy is a system used to deliver genetic materials such as a transgene or nucleus into the nucleus of a cell. It serves as a microscopic delivery tract that transports packages genetic material to specific locations that is target cells. So there are two main types of vectors used in gene therapy, which I mentioned above, a viral and non-viral. So in summary, a vector is a crucial component of gene therapy as it enables the delivery of genetic material to specific cells, targeting diseases at their molecular level and potentially offering new treatment options for patients with limited options.
Viral vector. It is a tool commonly used by molecular biologists to deliver genetic materials into cells. This process can be performed inside a living organism or in cell culture. Viruses have solved our way in encapsulating and delivering their genes to human cells in pathogenic manner. Scientists try to harness this ability by manipulating the viral genome to remove disease-causing genes and insert therapeutic ones.
Viral vectors in gene therapy. These vectors are often derived from viruses, which are naturally good at entering cells. In gene therapy, the viral machinery is reprogrammed to carry and deliver healthy genes instead of causing disease. One such type of vector is the lentiviral vector. The lentiviral vector is based on lentiviruses, a family of viruses that includes HIV. Scientists have cleverly modified lentiviruses to become safe and helpful tools for gene therapy.
Adenoviral vectors are vehicles used in gene therapy to deliver genetic material into target cells, derived from adenoviruses, which typically cause respiratory infections. These vectors are modified to remove their ability to replicate. Adenoviral vectors efficiently transfer genetic material into host cells, making them valuable for gene therapy and vaccine development. One example of an adenoviral vector used in gene therapy is adeno-associated virus, or AAV. AAV is a small non-enveloped virus that doesn't cause disease in humans. Researchers have modified AAV to deliver therapeutic genes into target cells, making it a commonly used vector for various gene therapy applications due to its safety and efficiency. Adeno-associated viral vectors are small non-pathogenic viruses commonly used in gene therapy. They are modified to carry therapeutic genes into target cells without causing disease. AAV vectors are attractive due to their low immunogenicity and ability to efficiently infect a broad range of cells, making them valuable tools for delivering genetic materials in gene therapy applications. One example of an adeno-associated viral vector is AAV2. It is derived from the naturally occurring adeno-associated virus, serotype 2, and has been extensively studied and modified for use in gene therapy. AAV2 is known for its ability to efficiently deliver therapeutic genes into various tissues with minimal immune response.
Non-viral vectors have certain advantages over viral methods, such as being easier to produce on a large scale and having lower host immunogenicity. In the past, non-viral methods had lower levels of transfection and impression compared to viral methods. However, recent advances in non-viral vector technology have resulted in techniques with transfection efficiencies similar to those of viruses. There are two main ways of non-viral vectors. The first one is physical vectors, or tools or methods used by researchers to directly deliver genetic material such as DNA or RNA to target cells. This can be done using techniques such as injections, needles, microinjections, or gene guns to transfer the genetic materials into the cells. Physical vectors allow for precise and specific delivery of genetic material, which can be important for gene therapy, genetic engineering, and other biotechnological applications.
Chemical vector is one of the two main ways of non-viral vector. Chemical vectors typically refers to synthetic carriers like liposomes or polymers used to deliver drugs or genetic material. Chemical vector, it uses synthetic materials that are compatible with a human body so that they are not as likely to generate immune responses. These include fat molecules, the lipids, polymers, and nanoparticles, particles that are extremely small with dimensions on the scale of nanometers. This vector can enhance drug delivery efficiency to reduce side effects. They play a significant role in targeted therapies and are explored extensively for medical applications beyond viral vectors. You can see here the example images of nanostructure for drug delivery in respiratory disease.
Example of a chemical vector is the lipid nanoparticles. The leading non-viral delivery method uses lipid nanoparticles. Lipid nanoparticles encapsulate genetic material so that it can be delivered to target cells. Without a delivery system like an LNP, genetic materials degrade quickly and cannot reach target cells. Because LNPs are quick to manufacture, efficient, and scalable to the size of the material being delivered. They have many potential uses in gene therapy.
Two types of gene therapy. There are several approaches for correcting faulty genes, the most common being the insertion of a normal gene into a specific location within the genome to replace a non-functional gene. Gene therapy is classified into the following two types: somatic gene therapy and germline gene therapy. The somatic gene therapy transfer of a section of DNA to any cell of the body that doesn't produce sperm or egg. Effects of gene therapy will not be passed on to the patient's children, while germline therapy transferred of a section of DNA to cells that produce eggs and sperms. Effects of gene therapy will be passed on to the patient's children and subsequent generations. Gene therapy is also a therapeutic gene transferred into the sperm into the gene. Germline gene therapy, therapeutic gene transferred into the germ cells. Gene introduced into egg cells and sperms. It is heritable and passed on to later generations. For safety, ethical, and technical reasons, it is not being attempted at present. Somatic cell gene therapy is a therapeutic gene transferred into the somatic cells. It is introduced of genes. It is It is an introduction of gene into bone marrow cells and blood cells, skin cells, and etc. Will not be transferred. Somatic cell gene therapy will not be transferred, inherited later generations. At present, all researchers directed to correct genetic defects in somatic cells.
Two types of gene therapy, depending on which types of cells are treated. Somatic gene therapy, transfer of a section of DNA to any of the body cells that doesn't produce sperms or eggs. Effects of gene therapy with not to be passed onto the patient's children. Germline gene therapy, transfer of a section of DNA to a cells that produce eggs or sperm. Effects of gene therapy will be passed on to the patient's children and subsequent generations.
Pros. Provides options. Gene therapy can potentially cure someone of a disease, especially in instances where no other medications have worked. Second, only has to be given one time. Existing gene therapies are given as one-time dose. This is appealing compared to some other treatments that required multiple doses. Third, long-lasting effects. Gene therapy has the potential to get rid of the person's symptoms for life. Gene therapy can give many people a better quality of life. Fourth, positive effects passed down through generations. If you remove a faulty gene from a parent, they won't transfer this gene to their kids. Last, rapidly changing technology. Gene therapy is able to exist because of massive advances in technology over the past few decades. Since technology continues to advance, we can expect gene therapy to continue to improve. We can also expect more gene therapies to gain FDA approval.
Cons. First is expensive. Gene therapy can be extremely pricey, making it inaccessible for some people. For example, Zolgensma, a gene therapy to treat spinal muscular atrophy, is the most expensive medication in the US. It costs $2.1 million for a course of treatment. So second is experimental. Gene therapy is relatively new and there's still a lot about it that we don't know. Right now, there are no guarantees exactly how successful gene therapy will be, still uncertain. The third is potentially dangerous. There is some concern that if gene therapy reaches other cells in the body beside the faulty cell, it could have harmful effects. There is also concern that reproductive cells could be changed without detection, and this could be passed on the people's children. Next is ethical issues. Some people have ethical issues with gene therapy. For example, some wonder who will decide that good and bad uses of gene therapy are. And will gene therapy make us less accepting of people who are different? The next is may cause infection. Some gene therapies use inactivated viruses to carry healthy genetic material into a faulty cell in the body. It's possible that these viruses could infect the person receiving therapy.
In conclusion, theoretically, gene therapy is the permanent solution for genetic diseases, but it has several complexities. At its current stage, it is not accessible to most people due to its huge cost. A breakthrough may come anytime, and a day may come when almost every disease will have a gene therapy. Gene therapy have the potential to revolutionize and practice of medicine.